Hello, my name is Alex, and I work as a mental health nurse. I created this segment in response to the need to address contentious and challenging issues from the viewpoint of a nurse who is a member of a minority. I'm from Chile, who must deal with cultural, linguistic, and generational challenges in a profession defined by the efforts to assist vulnerable people in difficult conditions. And I want to just take and attack these topics in a brief and direct manner. I want to discuss typical scenarios that may or may not occur to me in daily activities and at work. I want to share what I learned from them and perhaps consult with you if you have experienced something similar. I want to frame these talks from the standpoint of an immigrant who must deal with these quick and legitimate changes that frequently cause confusion for me, my family, and my coworkers. We have to deal with the circumstances in which there are almost no established procedures or official positions. Furthermore, it appears that institutions become perplexed and unsure of how to handle these issues. That is not a set of rules. Everybody's wondering what's the appropriate thing to do, and usually things get dropped. I'll get there in a little bit. Allow me to clarify that I'm not speaking for anyone other than myself. These are solely my ideas and opinions. I'm also in no way offering advice or attempting to persuade anyone with my remarks. I am attempting to contribute in a respectful and adult manner to any part of the nursing field or any field that may have questions or feel uncomfortable discussing contentious matters. Every video I will post will be available in both English and Spanish. Due to the language barrier, I believe that the Spanish population in particular can benefit from this discussion. I have crossed paths with a lot of Spanish people, co-workers, that have a lot of questions about they don't have the tools or they have not the initiative to ask or wonder about the things, especially they wouldn't approach a higher position person with a controversial matter like this. In addition, the English population can benefit, in my opinion, because I believe that some contentious issues have been weaponized, and that as a result of that, everyone feels intimidated and chooses not to speak up. My personal story is not relevant. Where I work is not relevant, so I will talk about issues without particular references that may bring confusion or may be used with an inflammatory function. The first topic, you guessed it, racism. When I type racism, the first definition given by my computer states prejudice, discrimination, or antagonism directed against a person, and this is the important part, antagonism directed against a person or people on the basis of their membership in a particular racial or ethnic group, typically one that is a minority or marginalized. When I read this definition, I realize that a lot of people may be committing racism without knowing it. In other words, and what has become more and more common, they may think that may not be racism to them, even when presented with clear and well-defined evidence. It's not uncommon that at work I try to clarify some cultural differences, and the response is, well, not to me. That may be the definition, but to me, it's not the case. When I read, I work in one of the most diverse unit, in a psychiatric unit, in a hospital. And let me tell you that when people come to live in the USA from another country, they develop a set of tools that allows them to coexist with people from all over the world. We can refer to these tools as a mental plasticity or having an open mind. These are my words. And I would define this as the capacity to adjust or change as a response of the always evolving environment. I believe that's a definition related to the concept also of intelligence. Unfortunately, there is a section at work that hasn't developed these skills, and I'm going to be very careful and clear with this. These are the ones born here and do not belong to a minority group. This is nobody's fault, but they haven't had to develop these skills. But nonetheless, these represent an inconvenience in daily interactions, requiring a higher view or more experience with cultural sensitivity. Let me repeat this and be very clear about this. It's nobody's fault, but it has a negative effect many times. Allow me to expand with an example that is simple but powerful. I work in a psychiatric unit and I was dealing with a loud patient belonging to a Middle Eastern culture. He was demanding to talk to a male nurse because he didn't like the way our female staff was talking to him. When I get there, in the middle of the heat, I realized that the nurse, instead of asking the patient to lower their voice calmly, she was upset and shushing at him to make him lower his voice. I told the nurse that to shush, I believe is the word, at the person in many other countries is very disrespectful. It is in my country at least. It's a very disrespectful way of talking to a person, and we can find a male person to talk to him. I can do that. But she was already as upset as the patient and didn't want to proceed this way because the rules of the hospital said that people are supposed to be quiet at night. And she followed up with more mumbling about the policy. These situations are so common that people wouldn't believe me. When a person from another country tells you something particular about their country or any other country, is not something open to debate. If I tell you that shushing at a person is disrespectful in Chile, where I am from, the only answer to that from you is sure, okay, or oh, interesting, etc. There is nothing to debate here. It wasn't a question, nothing to antagonize or disagree with. To do so is invalidating the validity, this may sound redundant, of the cultural aspect that I'm trying to convey to the other person. If I say something, you don't say, This is what I mean when I mention, let me go back to the definition, antagonism directed against a person or people on the basis of their membership in a particular racial or ethnic group, typically one that is a minority or marginalized. This is what I mean when I mention that many people engage in racist behavior without realizing it. It's not their fault, but it's occurring. The majority of the time, this is the result of an immature mind. Not because there is confusion, it's because nobody was asking to evaluate this cultural anecdote or fact. A person who hasn't personally experienced diversity, and they believe that, and this is important because your trip to Mexico doesn't give you the perspective needed to confront diversity for the rest of your life. Living there for years, not just visiting for a couple of weeks, what we call vacation, is the only way to truly comprehend a culture. When an immigrant or a minority person holds a position like church, and let me go back again, when a non-immigrant or minority a non-immigrant or non-minority person holds a position like charge nurse or higher and must resolve a conflict among coworkers, particularly one involving a member of a minority group. Many situations deteriorate because they are attempting to follow policy, even if they typically lack the tact or experience to do so. They believe they are acting morally, and they have the best moral intention, with not the best results. Obedience to the rule has no way to the sensitivity needed to deal with these extremely complicated but necessary concerns. The person following only policy is merely being cautious. In this way, in this case, the whole is bigger than the right thing to do is bigger than following just policy. I think that's the concept of synergy. The whole is bigger than the addition of the parts. That can be a metaphor for this concept. Unfortunately, frequently a leader position will dismiss the situation, and I may or may not involve in a case like this recently. Or treat the participant, and this is the most common, unfortunately, situation, like children. I have the impression that the only way that this happens more or less in the charge nurses field, they try to address the conflicting parts the way the parents, when addressing them, when they were fighting with their brothers or kids or something like that, and look so silly and dismissive. And again, this may be done with the best intention. If a person does not belong to the minority group, they cannot be the gatekeeper representing them. Instead, they should either avoid intervening in the matter, because it's going to make it worse, or seek the assistance of someone more qualified. Somebody that may have not the particular knowledge of that culture, but can have a bigger world view, that may know what that person means, despite that not tapping in the detail. There is nothing wrong with the non-minority people, of course, but they cannot possibly understand unless they are members of the minority. No married to a minority, no friends with a minority, or working with a minority. In relation to the above mentioned, in the page is the above part. Most of the positions where something can be done to minimize these problems are occupied by non-minority staff. And without existing bad intention, this situation perpetuates the problem. Again, how could they possibly understand? No matter how many degrees or years of experience the person may have, because they will tend to lean towards the institutional side without even knowing it. In a sense that their job, we call that follow policy. And it's usually the shortest economic way to deal with something, and that's it, we're done. But that leaves a resentment many times, that leaves in the worker that feeling, that sensation that, oh man, my charge nurse or my supervisor or whatever is not getting what I'm saying. And there is not a translator for that thing. On the other hand, this is important also. Many times racist mistakes are committed with bad intentions, but that's a topic for another time. My name is Alex, I'm a nurse, I work in a psychiatric section. I want to open a door for everybody to at least see what we minorities have to encounter what we may think, because the tendency is not to interview somebody about these things, especially by the fear of insulting somebody, and things are being, unfortunately, weaponized nowadays. If I say something, somebody's gonna grab it, misconstrue it, and pretend that I said something different, when many times I'm asking what things mean. Sometimes I don't know what a word means. This is my first video. Sorry about there is a lot of room for improvement, and just remember, you don't have to like, you don't have to share this video, and you don't have to subscribe. Thank you very much.